And welcome back to the channel. So if you have ever wondered why is my period lasting so long, so you are not alone. For many women, an unusually long period can be frustrating, uncomfortable and very concerning. So in today's video, we are diving into the reasons behind prolonged menstrual cycles and discussing some effective cures and treatments. So if you have been experiencing longer than normal periods, keep watching to find out what might be the going on and how to manage it. So, what's considered a normal period? First, let's start with the what a typical menstrual cycle looks like. For most women, a period lasts between 3 to 7 days, and the cycle itself is usually about 28 to 35 days long. But what happens if your period lasts longer than that? Is it something to be worried about? Well, the answer isn't always straightforward because periods can be influenced by many different factors, from hormones to lifestyle changes. So, possible reasons your period is lasting so long are so, first in the list is hormonal imbalance. One of the most common reasons for prolonged periods is a hormonal imbalance. Specifically, imbalances in estrogen and progesterone, two key hormones that regulate your menstrual cycle, can cause changes in how long your period lasts. When estrogen levels are too high or progesterone is too low, the uterine lining may build up more than usual, leading to longer and heavier periods. Also, the second reason is polycystic ovary syndrome. PCOS is a condition that affects how the ovaries function, and one of its symptoms is irregular or prolonged periods. Women with PCOS often have higher levels of androgens, which can lead to infrequent ovulation, resulting in periods that either come very late or must last longer than normal. Third is uterine fibroids. Fibroids are cancer-rich growth that are in the uterus that can cause heavy and prolonged bleeding. If you have noticed your periods becoming increasingly long and painful, fibroids could be a factor. These growths can vary in size, and while some women may not experience any symptoms, others may have heavy and extended periods as a result. Fourth is adenomatosis. This occurs when the tissue that normally lines inside the uterus starts growing outside of it, often on the ovaries or fallopian tubes. This can cause extremely painful and prolonged periods, along with other symptoms like pelvic pain and discomfort during sex. Adenomyosis is a common cause of abnormal bleeding and may require medical attention. Fifth is thyroid issues. Your thyroid gland plays a huge role in regulating your menstrual cycle. Both an underactive thyroid and overactive thyroid can lead to irregular periods. So, if your period is lasting much longer than usual, it might be a good idea to have your thyroid function checked. Fifth and sixth is birth control. Certain types of birth control, especially hormonal or both birth control pills, can cause changes in your menstrual cycle. Sometimes the changes result in lighter and shorter periods, but in other cases, they can lead to prolonged bleeding. If you have recently started or changed birth control methods, this could be the reason behind your longer period. Seventh is stress and lifestyle changes. Stress can seriously mess with your hormones, leading to irregular or longer periods. If you have been under a lot of stress lately, whether from work, school, or personal issues, it could be affecting your menstrual cycle. Other lifestyle changes like significant weight gain or loss, excessive exercise, or a poor diet can also throw your cycle off balance. So, other medical conditions, in some cases like prolonged periods, may be a sign of other underlying health conditions such as bleeding disorder or certain cancers of the reproductive organs. If your periods are constantly lasting more than 7 days and are accompanied by other usual symptoms, it's essential to consult a healthcare professional. So, what can be done other than that to treat or cure prolonged periods? First is hormonal treatments. If a hormonal imbalance is the culprit behind your long periods, hormonal treatments like birth control pills, patches, or IUDs may help regulate your cycle. These treatments work by stabilizing hormone levels and reducing the length and heaviness of your periods. However, it's important to speak with a doctor to determine which option is best for you. Second is anti-inflammatory medications. Over-the-counter non-steroidal anti-inflammatory drugs such as ibuprofen can help reduce menstrual bleeding by decreasing the production of prostaglandins, which are chemicals in your body that promote uterine contractions. While they won't completely cure prolonged periods, they can help ease heavy bleeding and discomfort. Third is iron supplements. If you are experiencing heavy bleeding for an extended period, it's easy to become iron deficient, leading to anemia. So, taking iron supplements can help restore your levels and prevent fatigue and other symptoms associated with the anemia. So, it's always a good idea to check your iron levels if you are dealing with heavy or long periods. Fourth is managing stress and lifestyle. Sometimes managing stress can work wonders for your menstrual cycle. So, techniques like meditation, yoga, or simply taking time to relax can help balance your hormones and prevent longer periods. Also, maintaining a healthy diet, exercising moderately, and getting enough sleep can help regulate your cycle. Fifth is treating underlying conditions. If your long periods are due to condition like PCOS, fibroids, or adenomyosis, your doctor may suggest specific treatments. For fibroids or endometriosis, options range from medication to surgery depending on the severity of the condition. So, treating thyroid issues either through medication or other therapies can also help regulate your cycle. Sixth is endometrial ablation or surgical options. In more severe cases, particularly for women who have finished having children, endometrial ablation, a procedure that destroys the uterine lining, can be an option. So, this procedure reduces or completely stops menstrual flow. In extreme cases where other treatments have failed, surgery like hysterectomy can may be considered. So when to see a doctor? If your period lasts longer than 7 days consistently, or you experience other symptoms like severe pain, heavy clotting, or fatigue, it's very crucial to speak with your healthcare provider. Long periods may be a sign of more serious condition that requires treatment. So that's it for today, guys. Long periods can be frustrating, but understanding the cause is the first step towards finding a solution. Whether it's a hormonal imbalance, stress, or medical condition, there are treatments available to help. If you are dealing with prolonged periods, don't hesitate to seek medical advice to get the care you need. So, if you find this information helpful, so make sure to like and subscribe for more health tips and advice. And if you have any questions or personal experience to share, feel free to drop in the comments below. I would love to hear from you. So until then, stay healthy, take care, and I will see you in the next video. Thank you so much for watching.